Pregnancy is a unique time in a person's life, bringing about many changes and considerations, especially when it comes to health. One of the most important aspects of prenatal care is ensuring both the mother and the developing baby are protected from preventable diseases. Vaccines play a crucial role in this process. In this video, we'll explore which vaccines are commonly recommended during pregnancy, why they're important, and how they help keep both mom and baby safe. Let's begin our journey by understanding the basics of vaccines and their role in pregnancy. Vaccines are not just about personal protection, they also help protect those around us, especially vulnerable populations like newborns. During pregnancy, a mother's immune system changes, making her more susceptible to certain infections. Some diseases can also be more severe during pregnancy, posing risks to both the mother and the baby. By getting recommended vaccines, pregnant people can pass on protective antibodies to their babies, offering them early immunity. This is why healthcare providers emphasize the importance of vaccination during pregnancy. There are a few vaccines that are routinely recommended for pregnant people. These include the influenza flu vaccine and the Tdap vaccine, which protects against tetanus, diphtheria, and pertussis, whooping cough. These vaccines are considered safe during pregnancy and are highly effective at preventing serious illnesses. The timing of these vaccines is also important, as it maximizes the transfer of protective antibodies to the baby. Let's take a closer look at each of these vaccines and why they're so important. The influenza vaccine, commonly known as the flu shot, is recommended for all pregnant people during flu season, regardless of the stage of pregnancy. Pregnant individuals are at higher risk for severe complications from the flu, such as pneumonia and hospitalization. Getting the flu shot not only protects the mother, but also helps shield the newborn from influenza in the first few months of life when they are too young to be vaccinated themselves. The flu vaccine used during pregnancy is the inactivated version, which is safe for both mother and baby. The Tdap vaccine protects against 3 serious diseases: tetanus, diphtheria, and pertussis, whooping cough. Pertussis can be especially dangerous for newborns, leading to severe coughing spells and even life-threatening complications. The Centers for Disease Control and Prevention, CDC, recommends that pregnant people receive the Tdap vaccine during each pregnancy, ideally between 27 and 36 weeks. This timing ensures the highest level of antibody transfer to the baby, providing crucial protection in those early months. One of the remarkable benefits of vaccination during pregnancy is the transfer of antibodies from mother to baby. These antibodies cross the placenta, providing the newborn with passive immunity against certain diseases during the first few months of life. This is especially important because babies are too young to receive many vaccines themselves. By getting vaccinated, mothers help bridge this vulnerable period, giving their babies a strong start in life. The timing of vaccines during pregnancy is carefully chosen to maximize benefits. The flu vaccine can be given at any stage of pregnancy, while the Tdap vaccine is best administered between 27 and 36 weeks. This timing ensures that the highest levels of protective antibodies are passed to the baby before birth. If you're pregnant, it's important to discuss the best timing for these vaccines with your healthcare provider to ensure optimal protection for both you and your baby. While some vaccines are recommended during pregnancy, others should be avoided. Live vaccines, such as the measles, mumps, and rubella, MMR vaccine, and the varicella chickenpox vaccine, are generally not recommended during pregnancy due to the theoretical risk to the developing baby. If you need these vaccines, it's best to get them before becoming pregnant. Your healthcare provider can help you plan your vaccination safely. The COVID-19 pandemic has brought new considerations for vaccination during pregnancy. Leading health organizations, including the CDC and the World Health Organization, recommend COVID-19 vaccination for pregnant people. Studies have shown that the vaccines are safe and effective during pregnancy, and they also help protect the newborn by passing antibodies through the placenta. If you're pregnant, talk to your healthcare provider about the best timing and type of COVID-19 vaccine for you. Depending on your health, travel plans, or risk factors, your healthcare provider may recommend additional vaccines during pregnancy. For example, the hepatitis B vaccine may be advised if you are at risk of infection. Similarly, vaccines for meningitis or travel-related diseases might be considered in special circumstances. Always consult your provider to determine which vaccines are right for your unique situation. Safety is a top concern for anyone considering vaccination during pregnancy. The vaccines recommended for pregnant people, such as the flu and Tdap vaccines, have been extensively studied and are considered safe for both mother and baby. Side effects are generally mild, such as soreness at the injection site or mild fever. Serious side effects are extremely rare. If you have concerns, your healthcare provider can address them and help you make an informed decision. Vaccines work by stimulating the immune system to produce antibodies against specific diseases. When a vaccinated person encounters the actual disease, their immune system is ready to fight it off more effectively. During pregnancy, this process not only protects the mother, but also allows protective antibodies to be passed to the baby. This transfer of immunity is a key reason why certain vaccines are recommended during pregnancy. Vaccination during pregnancy offers direct benefits to the mother. It reduces the risk of contracting serious illnesses like influenza and pertussis, which can be more severe during pregnancy. By staying healthy, mothers are better able to care for themselves and their developing babies. Vaccines also help prevent complications that could lead to hospitalization or other health issues during pregnancy. The baby also benefits greatly from maternal vaccination. Since newborns are too young to receive many vaccines, the antibodies they receive from their mother provide essential protection in the first months of life. This can help prevent serious illnesses like whooping cough and influenza, which can be life-threatening for infants. Maternal vaccination is a simple and effective way to give babies a healthy start. There are many myths and misconceptions about vaccines, especially during pregnancy. Some people worry that vaccines can harm the baby or cause pregnancy complications. However, scientific studies have shown that recommended vaccines are safe and do not increase the risk of miscarriage, birth defects, or developmental problems. It's important to rely on trusted sources and consult healthcare professionals when making decisions about vaccination. Every pregnancy is unique, and vaccine recommendations may vary based on individual health, medical history, and risk factors. That's why it's essential to have open conversations with your healthcare provider. They can help you understand which vaccines are right for you, address any concerns, and ensure you and your baby are protected throughout your pregnancy. Keeping accurate records of your vaccinations is important during pregnancy. This helps your healthcare team track which vaccines you've received and when, ensuring you stay on schedule. It also helps avoid unnecessary repeat vaccinations. Bring your vaccine records to each prenatal visit and update them as needed. If you plan to travel during pregnancy, you may need additional vaccines depending on your destination. Some countries require vaccines for diseases like yellow fever or typhoid. Always consult your healthcare provider before traveling to ensure you have the necessary protection. They can advise you on which vaccines are safe and recommended during pregnancy for your specific travel plans. Some vaccines are best given before pregnancy, such as the MMR and varicella vaccines. If you're planning to become pregnant, talk to your healthcare provider about your vaccine history. Getting up to date on these vaccines before conception helps protect both you and your future baby from preventable diseases. After your baby is born, you may need additional vaccines, especially if you missed any during pregnancy. Some vaccines, like MMR or varicella, can be given safely after delivery. Breastfeeding mothers can also receive most vaccines, which may provide additional protection to their babies through breast milk. The process of antibody transfer from mother to baby is a natural and vital part of pregnancy. Antibodies produced by the mother in response to vaccines cross the placenta, especially in the third trimester. This transfer provides the baby with immediate, though temporary, protection against certain diseases until they can receive their own vaccines. Pertussis, or whooping cough, is a highly contagious respiratory disease that can be life-threatening for infants. The Tdap vaccine given during pregnancy is the best way to protect newborns from this disease. By vaccinating during the recommended window, mothers pass on high levels of pertussis antibodies, significantly reducing the risk of severe illness in their babies. Influenza can cause serious complications during pregnancy, including pneumonia, preterm labor, and hospitalization. The flu vaccine is safe at any stage of pregnancy and is the best way to prevent these complications. It also helps protect the newborn, who is at high risk for severe flu illness in the first months of life. Recent studies have shown that COVID-19 vaccines are safe and effective for pregnant people. Vaccination reduces the risk of severe illness, hospitalization, and complications from COVID-19. It also provides antibodies to the baby, offering protection in the early months of life. Ongoing research continues to support the safety and benefits of COVID-19 vaccination during pregnancy. If you must travel to areas where certain diseases are common, your provider may recommend additional vaccines. Some travel vaccines are safe during pregnancy, while others are not. Always discuss your travel plans with your healthcare provider well in advance to ensure you receive the necessary protection without compromising your or your baby's safety. Hepatitis B is a serious liver infection that can be transmitted from mother to baby during childbirth. If you are at risk for hepatitis B, your provider may recommend vaccination during pregnancy. The hepatitis B vaccine is safe and effective, helping to prevent transmission to your baby and protecting your own health. Most vaccines are safe for breastfeeding mothers. In fact, Some antibodies produced in response to vaccines can be passed to the baby through breast milk, providing additional protection. If you're breastfeeding after delivery, talk to your provider about any vaccines you may need and how they can benefit both you and your baby. Like any medication, vaccines can cause side effects. The most common are mild, such as soreness at the injection site, mild fever, or fatigue. Serious side effects are extremely rare. If you experience any unusual symptoms after vaccination, contact your healthcare provider for guidance and reassurance. Vaccines contain small amounts of antigens, which stimulate the immune system, as well as other ingredients like stabilizers and preservatives. All vaccine ingredients are thoroughly tested for safety. The vaccines recommended during pregnancy have been shown to be safe for both mother and baby, with no evidence of harm from their ingredients. After birth, a baby's immune system is still developing. The antibodies received from the mother provide protection for the first few months, but this immunity gradually fades. That's why it's important for babies to start their own vaccination schedule soon after birth to maintain protection against serious diseases. If you have a chronic health condition, such as diabetes or heart disease, you may be at higher risk for complications from certain infections. Your provider may recommend additional vaccines or adjust the timing of routine vaccines to ensure you're fully protected. Always share your full medical history with your healthcare team. Immunization schedules are designed to provide protection at the right time. During pregnancy, the schedule may include the flu vaccine at any stage and the Tdap vaccine in the third trimester. Your provider will help you stay on track and ensure you receive all recommended vaccines at the appropriate times. When more people are vaccinated, it helps protect those who cannot be vaccinated, such as newborns and people with certain medical conditions. This concept, known as community immunity or herd immunity, is especially important during pregnancy, as it helps shield vulnerable infants from serious diseases. Healthcare providers play a vital role in guiding pregnant people through vaccine decisions. They stay up to date on the latest recommendations and research, answer questions, and provide reassurance. Building a trusting relationship with your provider ensures you have the information and support you need to make the best choices for your health and your baby's health. Vaccine recommendations for pregnant people are similar around the world, with organizations like the World Health Organization and CDC providing guidance. However, specific recommendations may vary based on local disease risks and vaccine availability. Always follow the advice of your local healthcare provider and public health authorities. Vaccines recommended for use during pregnancy undergo rigorous research and testing to ensure their safety and effectiveness. Ongoing studies continue to monitor vaccine outcomes in pregnant people and their babies, providing valuable data that informs public health recommendations and keeps families safe. Vaccine hesitancy can be a barrier to protection for both mothers and babies. Addressing concerns with accurate information, empathy, and support is key. Healthcare providers can help by listening to worries, providing evidence-based answers, and respecting individual choices while emphasizing the benefits of vaccination. Pregnancy naturally alters the immune system, making some infections more likely or more severe. This is why certain vaccines are especially important during pregnancy. Understanding these changes helps explain why vaccination is a key part of prenatal care. It's not just the pregnant person who should be protected. Partners, family members, and caregivers should also be up to date on their vaccines. This helps create a safe environment for the newborn, reducing the risk of transmitting preventable diseases to the baby. Access to vaccines can vary based on location, income, and healthcare resources. Ensuring equitable access to recommended vaccines during pregnancy is essential for protecting all mothers and babies. Public health programs and community outreach can help bridge gaps and promote healthy outcomes. To recap, the most commonly recommended vaccines during pregnancy are the influenza flu vaccine, the Tdap vaccine, and, in recent years, the COVID-19 vaccine. These vaccines are safe, effective, and provide important protection for both mother and baby. Additional vaccines may be recommended based on individual risk factors or travel plans. Vaccine recommendations can change as new research emerges. Staying informed by following updates from trusted health organizations and maintaining regular communication with your healthcare provider ensures you and your baby receive the best possible protection. Making informed decisions about vaccination is an important part of a healthy pregnancy. By understanding the benefits, safety, and timing of recommended vaccines, you can take proactive steps to protect yourself and your baby. Empower yourself with knowledge and partner with your healthcare team for the best outcomes. If you have more questions about vaccines during pregnancy, there are many reliable resources available. Trusted organizations like the CDC, WHO, and your local health department offer up-to-date information and guidance. Don't hesitate to reach out to your healthcare provider for personalized advice. Vaccination during pregnancy is a safe, effective, and essential part of prenatal care. By following recommended guidelines, you can help protect yourself and your baby from serious diseases. Remember, your healthcare provider is your best resource for information and support. Wishing you a healthy, protected pregnancy and a strong start for your baby.